guys, our next speaker is my pleasure to introduce Nicolle Mitchell, who's a massage practitioner and trainer for dementia. So I won't say much more. You work part-time for the NHS as well, so lots of amazing experience, but a great area to listen from. Thank you.
Well, good afternoon. Thank you for having me. What do I press? Do I just press the down key to move on, do I? Yes, yeah. Brilliant. Okay, so one of the things that I do is I teach people how to use nurturing touch and massage to help connect on a deeper level with people living with dementia. It was a course I wanted to go on years ago when I first started, when I was invited to a local nursing home to treat people who live with dementia. Okay, so we're going to ask about the benefits of massage for dementia today, or for a person with dementia. But what are the benefits for a person with regards to massage? So I thought we would start. Oh, no, I'm going backwards, sorry. So I thought we would start with a bit of an exercise and get things a bit zhuzhed up. I'm going to ask you to partner up. If you don't want to partner up and you're not comfortable about touch, well, actually, you'll have a really important role as well. And that will be as an impartial observer. So I'm going to ask you to partner up. One of you is going to be the receiver and one of you is going to be the giver. Then I would like you to take your receiver's hand and do a hand sandwich. Well, wait a minute. Check. So hang on a minute. You're very enthusiastic, but I've got a few more instructions yet. So this is the first part of the routine. Some people don't like a closed sandwich. They like an open sandwich because that can be feel a bit controlling. So the next thing I'm going to ask you to do as part of the routine is doing thumb circles on the palm. Avoid any lesions, avoid any arthritic or achy bits, nothing should hurt. And then I want you to do finger waves, if your partner will let you. You can go ideally from the elbow crease to the fingertips. And the slower and more rhythmic, the better. And then finally, just check in with about pressure. What I'm going to do is I want you to take about a minute each in your partners. And then when you hear the bong again, we'll stop. If you haven't swapped,
See this set of the really sorry, I know it's not.
So thank you for indulging me. I just would like some feedback from maybe one of the receivers for anything that they noticed, either in their head, their heart, or their bodies, that changed for them, just through in that brief intervention. Does anybody want to feedback how they felt? Yes. You immediately felt stress release. Okay, well that's brilliant, and that shows how quick that pathological chemical response kicks in, doesn't it? So thank you. And as a giver, does anybody want to maybe share how they felt, any changes they felt in their head, their heart, their bodies? You felt connected, brilliant, okay. And that's absolutely one of the key points that I'm going to be talking about today. And any observers, did you notice any changes at all? Anybody who didn't take part in partnering up? Anybody, hands up? Any observers? Yes. And how did that make you feel as an observer? A little bit of a heart moment. Yeah. Okay, brilliant. So we'll come back to that in a wee minute. So during the pandemic, hands up if you felt isolated, touch starved, touch deprived. Okay, so a handful of you. Yeah, I definitely did. And what happened is during the pandemic, during that first lockdown, there was some research done of just under 1,500 people, mostly in the UK, but in a handful of other countries as well. It was all done online. And it was really to understand how much we crave touch when it was denied to us. And there were different types of touch as well. So they differentiated between intimate touch, friendly touch, and professional touch. And as you can expect, the lower amount of touch experienced, the more we craved it and the more that our anxiety and feelings of loneliness elevated. What was particularly interesting, because they also, they asked people about their attachment styles as well. And people with attachment anxiety, their craving for touch went up, but particularly for friendly touch, because those people maybe need their peer groups more. And there was another exception as well with regards to attachment styles. So those people who are maybe more avoidant in their attachment, they were more likely to, well, they were less likely to crave more touch. And that was specifically with regards to intimate touch. So I thought this just kind of gives us a little bit of an insight of how much of an impact the lack of touch had during this time if we didn't feel it ourselves. And certainly there was a lot of media coverage as well, wasn't there, about residential homes and people not being able to see their loved ones and how quickly their health and well-being deteriorated during those times. So what are the benefits with regards to massage in particular? Well, you've already felt some of them, and de-stressing, calming down is one of them. And in particular, the behavioural and psychological symptoms of dementia are supposed to be reduced, according to some of these studies, particularly with regards to agitation, aggression, depression, etc. I don't really like to call them behavioural and psychological symptoms of dementia. I think a lot of the time we medicalise something which is actually just about a human need. And I feel that behind every behaviour, which is a form of communication, there are feelings and there are unmet needs. And I think touch can cut through to that really quite quickly. It can be enabling. Anybody who understands that a traumatized or a stressed brain is a brain that goes offline. So if you think the executive brain goes offline, the emotional brain goes offline, and then you're left just with the brainstem going fight, flight, and having to do something about that. Obviously, massage can help reduce stress. And by reducing stress, then you're bringing all the parts of the brain back online again. And I feel that that's very enabling, especially when you're looking to seek permission, because you want someone to feel as enabled as possible before you seek permission for them for any sort of touch treatment. It improves relationships by giving opportunities for genuine present companionship. And by doing that, it actually reduces the caregiver burden. Kilstoff and Chenoweth, they found that people who had massage were more likely to initiate, they were more likely to be independent, they were more likely to do things for themselves, and they were more likely to communicate, be more verbal, etc. And it also reduces heart rate and blood pressure. I did some work on the renal unit, so nothing to do with dementia, but just as an anecdotal story really. When I worked at the renal unit in Trelisk, just prior to people going on to dialysis, they would have the patients would have their blood pressure taken, and the nurses and the HCPs would come around, take their blood pressure, and were really shocked at how much people's blood pressure reduced. And actually that set people up for a much more, well, don't want to say pleasurable experience, but maybe a more dignified experience, maybe a more manageable experience. It can improve sleep, so a bit of a topic of the day really, and it might only be a few extra minutes of sleep extra a night, but certainly again there's evidence to say that it does improve it incrementally. But also you know, again, within my general practice and when I get feedback from carers, I hear that people have slept better, longer, deeper. And very importantly, I think it's about validating an actual person. And when someone is very present and they're spending the time touching somebody in a nurturing way, I think it makes them feel like they matter. I feel like I'm brandishing a weapon here. It increases feel-good hormones, so things like serotonin, dopamine, and also the oxytocin. And going back to the exercise that you very kindly indulged me in, I have this theory, this kind of pyramid in my head, if you like, about the way oxytocin works. When we fall in love, have sex, breastfeed, we release massive amounts of oxytocin, don't we? And when we hug and when we massage, we also release that oxytocin. So the receivers in the room, we're getting that higher dose of oxytocin. The givers, because you're involved in that positive feedback loop of reciprocation, I guess you probably had a good dose of it as well. Then the observers in the room, they were watching these lovely things and interactions and connections going on, and they felt that too. And then there's even just thinking about it. So when you leave and you think about this lovely presentation and how you were touched really lovely in a lovely way by a stranger, then hopefully that will release the oxytocin as well. There's a lady that I go and see in the community, and she really taught me quite an important lesson. And I always used to, well, I still always ring her and let her know that I'm on my way, just so that, you know, she's prepared for me. And one day I was running late, and I didn't have a chance to ring her. And I thought, as I was going up the A30, shall I pull over and ring her? And I thought, no, I'll just push on through. So I ended up on her doorstep. Hi, Joni. And she said, oh, hello, Nicole. What are you doing here? And I said, oh, I'm really sorry. I forgot to call you and let you know I was on my way. I said, do you still want me to come in? She goes, oh, no, come on in, dear girl. She loves her massage. So I went in and she just went, oh, blast. And I said, well, what's the matter, Joni? Are you sure everything's okay? And she went, yes, I just really missed the joy of the anticipation of you coming. And I was like, oh, I'm so sorry. But I said, you know what, that's a really important lesson for me. And it's now something I pass on within my teaching as well, because I didn't realise that something that can just bring so much joy for so long could be so disabling. So yes, that's really important about me ringing them. But also, again, just illustrates how that feel good starts even long before you've actually touched someone in a nurturing way. It reduces cortisol levels. And I think the lady over here who said how, you know, she felt less stressed, she probably was starting to feel those cortisol levels sort of like tail off a bit. Managing pain. There's still a lot of research needed in this area, but nice guidelines say for everybody, lower back pain is definitely addressed through massage and touch. But there is some incidental evidence that, you know, which is saying that it would be worthwhile to do some more. It can mean that a person feels safer if massage helps someone regulate. And if you're familiar with Bessel van der Kolk's work, he talks about the three main forms of regulation, which are touch, movement, and what's the other one? Touch, movement, can't remember the other one offhand. Breathing, that's the other one. But I would also add in our regulating storytelling voice as well to that. So massage helps us regulate and co-regulate with people. And by doing that, if someone is having their needs addressed and they're regulated, they're less likely to show aggressive behaviour and hit out. They're less likely to cause harm to themselves. How many times have you seen maybe people who live with dementia picking at themselves? And that's down to an unmet need, I feel. It's a form of communication, because when words escape us, touch says it all. And it can be a form of comfort, especially at the end of life. So some of the implications of weaving touch, because I'm not into saying everybody should sort of like learn how to give a massage treatment. What I do teach, you know, with certain people who come and who sign up to my courses, is how to weave it into the everyday practice within our either clinical practice or care. And a couple of the studies showed that it actually takes a minimum amount of training for people to learn some focused touch techniques to make a real difference. And I think just what you experienced today was just a small illustration of that. Also, where to massage, the C-tactile afferent nerves, you know, the nerves that send the lovely messages to your brain when you've been touched. They're more dense in your forearms, hence me asking you to do that as part of your exercise. And they're also really dense in your back as well. And of course, when we're massaging someone or we're approaching someone who might find it difficult to accept a massage, we can at least head towards them, put our hands out, and it's quite natural to take a hand, shake a hand, and find a way in to start maybe applying some sort of touch interventions. So often a short intervention, as you can see, can have a most profound effect. They did find in a lot of the studies that I've been reading that there was an overall improvement in well-being on many levels, so emotional, mental and physical. And the carers who were receiving regular massage as well, not only did it reduce their stress levels, but when they were able to give massage to the people that they cared for, it made the road a lot less bumpy, hence reducing the caregiver burden. Again, it's connection without words. And it's also sort of, I think, something to consider that touch has to be context specific. This might not be the ideal place for you to receive nurturing touch. And I think it really is about, you know, us holding a space safely, because I think you have to feel relatively safe before you let someone touch you in an intimate way. And the other thing that came out was that ongoing regular massage or nurturing touch interventions have the biggest implications for ongoing well-being. So I just wanted to sort of like leave you with this quote, really. I won't leave it out, but as part of this review, what they found was that the more kind of holistic an approach was, and the more person-centered it was, the more it met that person's needs. So when I teach people, okay, I teach my specialist bit about touch, but I encourage them to pull all the skills and talents that they have in their box. So whether you incorporate art therapy or drama therapy, or you like to recite a bit of poetry with people, or you like to maybe play some music, if you can kind of bring all of this together and just have a most wonderful sort of therapeutic intervention with people. And really, it's about meeting that person where they are in that moment. So those are my contact details. And those are some of the references that I either use or I used for today, or that I use to recommend for reading or further viewing in my training. So any questions at all? Sure. Yes. So, for example, I was on a ward for the first time yesterday, and there was a patient who had dementia who was very distressed and had been on the ward for several weeks, had been very distressed and disrupted several weeks. Yeah. And I say that in I see what you're saying, yeah. Affecting everyone else's sleep, and the day that I came to the ward was the last day of that patient's stay after 12 weeks. Everyone kind of a sigh of relief. Patients who've been very upset for quite a long time left the ward, and I wonder if it would have been really helpful during that patient's extended stay to have access to someone like yourself while they were on the ward. I mean, this is the problem, really. I was speaking with Julie Pollard from Volunteer Cornwall, and she was saying that wouldn't it be great if we could have this socially prescribed. At the moment, I can only offer my services privately, but I'm open to, discussions. But the other thing is, maybe come and get some training, and I can train people how to take those very basic skills. Really, it's what we've all got the tools inside us. It's just maybe doing it with a bit more focus and a bit more understanding how to meet the needs. Like, I might say, okay, well, how is that person presenting? If they're presenting and they're calling out mum an awful lot, it might mean that they just need something that's going to meet, that need to feel like they're being cared for in a maternal way. So it might be some touch like this would be appropriate, or wiping away, they're there, the kind of replicating sort of parental touch. So it's just stuff that we know. I just give people a bit more focus and think about that compassionate curiosity, really, to understand what the need is behind the behaviour, so that then you can help meet that need. I think it was very clear that one of the triggers for her being very distressed and very understanding, I felt it being in the room as a clinician. I think the other patients could feel the distress when she had some urinary incontinence and needed some assistance. The saying the touch from the staff there was very clinical, and that made the patient upset and it made everyone in the room upset. You could really feel it, and I wanted there was training available. The staff who were involved in kind of dignity the behaviours that you want to preserve dignity, and you want to also be clinical at the same time. Of course, yeah, and that's about approach, and part of what I teach, as well as the sort of specialist touch techniques, is about whole sort of communication approach as well, and compassion absolutely is wrapped around that. And I also do things through a bit of a trauma curious lens as well, because how many people living with dementia are living with trauma because they've been diagnosed, because they're somewhere where they don't feel comfortable or safe. So of course they're going to be acting out in a way that we find challenging. So I did have, when I was working for Outlook Southwest a number of years ago, and I was facilitating dementia information forums or sessions, there was one couple that came along and talked about their aunt, and they said, that she used to go to church with them. They used to take her to church, and every Sunday she used to be very amorous with a particular chap who they felt reminded her of an illicit love affair way back in the day. So it all got a bit too amorous, though, and the chap who ran the congregation said, I don't know if you're going to be able to bring your aunt anymore, because she is really becoming quite a handful and embarrassing this man and people in the congregation. So I said, well, okay, so next time you bathe auntie, or sister bathes auntie, because they passed this information on to sister, who was the primary carer, I said, maybe think about how you massage their head when they're having a hair wash. Tell them I love you. And I say to people, if you're comfortable enough to say to somebody, that came up earlier on, that something was done with love, wasn't it? And if you do something with a loving intent with someone, I think that then it's okay to say, I love you. And they started doing this and they came back and they said, can't believe it. Complete difference. We started saying, I love you, turning the whole clinical sort of procedure into a loving, yes, it took a bit more time, into sort of like a loving interaction. And they said, and the next time they went to church, they were fine. And she said, I think she had her love tank topped up. She had her needs met. So I think it is about weaving that stuff in, and that's certainly something that I explore with people who do want to come to any training, how to weave it in and how to really meet those needs. Okay. Last question, okay. I'd love to, and I have done it before. Actually, I've worked with memory cafes. I've done Helston, Lost with Ill, Bude, and a few others. Sort of like, again, going back to Outlook Southwest days when we were delivering this, and this is going like back 10, 12 years. And yeah, I had quite a good connection with memory cafes, but I'd be very happy to rekindle that as well, because I realise that's a long time ago now. Thank you.